House Bill 3366. Somebody want to talk about it? Mr. Hart. Mr. Hart's recognized. Explain the amendment.
Information form, an opportunity for the patient to designate individuals with whom the provider may discuss the patient's medical condition and treatment. The amendment also exempts nursing homes, dentists, dental hygienists, dentist technicians from the requirements of this bill. In addition, the amendment changes the effective date to January 1, 2014.
Pending questions, the adoption of number 1. All in favor say aye. Opposed no. The ayes have it. Amendment 1 is adopted. Pending question is second reading on House Bill 3366 as amended. Mr. Crawford, for what purpose you rise? Mr. Crawford is recognized to speak on the bill.
Ladies and gentlemen, I'm concerned that we're flying through this because I had some questions for somebody at the podium. There's been some concern over this bill, and let me explain to you exactly why I'm talking to you about this, because I hadn't really intended to. So I understand the good intent here, which is to allow everybody to designate who we want their medical information released to, so that if somebody shows up and that person isn't there to tell me, I suppose, to tell that person, I can tell them. But let me tell you what I'm concerned about. I'm concerned about a lot of patients that I see who are majority age, who still have good relationships with their family, but they have some piece of health information that I'm going to have to know about it that they really don't want the rest of their family to know. And currently, I've just never really had a problem with whatever this is meant to address, but paper, and you say, son, write my name and sign here, and they stand over them till they sign it, and they bring me the piece of paper and say, now you have to tell me, and they can kind of bully them into signing that under duress. You know, I worry about the things that I'm going to tell people that people really don't want out there. I mean, I can't explain to you the number of young adults who have something of importance medically that they don't want mom or dad or an aunt or an uncle who would come and visit them at the hospital to know. And they'll tell me readily, I don't want you to tell mom and dad that. Well, and I mean, I take a really hard time, and so do my nurses and things, because our obligations to, if you're my patient, my obligation is to you. And I take that deathly seriously, as I know many of you do in your professions. And I get family members who are very upset because what they see is a non sequitur with what they know, but that's what the patient wants. And so if you give them some tool to make that patient under duress sign their name somewhere, because they might say, well, if you don't make that doctor tell me what he wants to tell me, then you can't live in the house, or, you know, I'm not going to take care of the baby anymore. I mean, I've heard all those things, and you know, my job is to take care of the patient. I'll take all the abuse, and I'll take all the vitriol of the family to protect what that patient wants to have private, which is the whole point of all our health privacy laws. And so I'm not sure why we're doing this. And I would ask that that when I step away from the podium, that we make a motion to adjourn debate for a day at least, until somebody will come to this podium and at long time answer for us why it is we're trying to fix something that I view as very possibly a tool to make people have very private things shared with family members that they don't really want shared now. This concerns me because it really impacts my day-to-day in the emergency department, as you might guess. Well, no,
Mr. Bedingfield, for what purpose you rise? All right, but first, Mr. Simmer requests debate. Mr. Bedingfield.
Adjourn debate until next Tuesday.
You move to adjourn debate until next Tuesday? Mr. Bedingfield moves to adjourn debate on the bill until next Tuesday. Mr. Smith moves to table the motion to adjourn debate. Mr. Hyde asks for a roll call. The 9 members second the request. 9 do. Roll call is ordered. The pending question is tabling the motion to adjourn debate.